This is right off of the charts of the Vitamin D Council. And look, autism is running rampant in the world market. D3 is absolutely imperative if anybody's going to have any hope of getting better. Rheumatoid arthritis, Crohn's disease is arthritis of the colon. Tuberculosis, that lung problem, that bacterial lung problem. D3 is probably the reason the bacteria had a chance to get in. Septicemia, that's where people get toxic into their blood. Did you know that people that have insomnia just can't sleep worth a hoot? D3 deficiency a lot of times. Some people with certain forms of hearing loss where they can't hear certain decibels, too high, too low. D3 has actually helped expand the range of their hearing. Muscle pain, cavities in the teeth. You know, the bones and the enamel of the teeth are very much related to the D3 ability of the body to absorb and assimilate minerals. Schizophrenia patients do very well with D3. Periodontal disease, that's where people have gum disease. Myopia, that's nearsighted. It's a direct correlation to children becoming myopia, nearsighted, can't see things far off without corrected vision. And had these children had D3 earlier, myopia would have been very likely curtailed. Macular degeneration in the eye, in the actual retina portion of the eye. Athletic performance. Give a patient 5,000 units of D3, put them on the athletic field, and watch the ability to recover, recoup, and to perform. Men and women that are trying to have children, and they find that they are infertile, whether it's he or she. D3 is one of the major nutritionals that has to be in the market to work in order for fertility to be successful. All seizure patients, people with epilepsy, particularly those that are on drugs like Trileptal or Dilantin or Depakote or those drugs that they use for seizures, deplete the body of vitamin D3. So it's very important. Let's think now, if a person had seizures, they took Trileptal or Dilantin, they're depleting their body of D3. What's the one thing that usually shows up in seizure patients first? A poor immune response. They're first to get the flu, first to get bronchitis, first to get pneumonia. And it's all because they're D3 deficient. Cystic fibrosis. The lungs require D3. Migraine headaches. You know, most people are sensitive to citrus, chocolate, and cheese. And if you put citrus, chocolate, and cheese in one daily regimen of food, they're much more prone to migraine headaches. But D3 controls those aspects of hyperfood sensitivity, migraine headaches. Depression. How many people do you know that are mully grubs, moody blues, on Prozac, on Zoloft, on Celexa, on this, on that? Well, in reality, the root cause is that until they get D3, there's no hope of their drugs ever becoming stable or their mind ever getting a more normal dopamine, serotonin, melatonin, the chemistry that's out there. All Alzheimer patients, every single one of them, when they do clinical autopsies on a patient who has died with Alzheimer's, every single one of them were vitamin D3 deficient. What does that tell you? And look, the major reason that D3 on the next slide works so well for you, there are over 30,000 genes in your human body. Vitamin D3 influences 2,000 of the genetics of your human body. We're now learning that with sirtuin enhancement, with genetic turning on and genetic turning off, we're talking about nutrition like resveratrol and ellagic acid in the raspberry, and here's a new nutrition, isLife with vitamin D3. We're literally talking about turning on good genes and turning off bad genes. That's the primary reason that vitamin D3 is so specific in influencing so many of the problems that we had on the chart before that. Osteomalacia, this is one way to tell whether you are severely D3 deficient. You can press the bone in your forearm tonight, or you can press the bone in your shin Or you can press the bone in your sternum of your chest, and if you have pain in that bone from pressing, that's called osteomalacia. That is a vitamin D3 deficiency. Head sweating. People that profusely sweat in their head, particularly at night when they're trying to go to bed, that's a D3 deficiency. And if you comb or brush your hair and you say, oh, my hair hurts, that's vitamin D3 deficiency. So how important is it? You heard it. It's very important. The next slide is going to take you to chelated minerals, and what we have here is very, very highly unique. Our chelation, our ability to put these mineral blends together, is literally going to give your body a much, much more enhanced oxygen ability. So there's new hope. We're in an oxygen-starved world. You know, and this particular portion of the isLife, the chelated mineral blends, is in the formula for vital cellular nutrition. It helps the cell to speak to the other cells. It's the building blocks, minerals like magnesium, calcium, the boron, the main little things like chromium, and get right on down the list. It just goes on. Actually, you need about over 70 minerals in order for your body to reach peak performance. And when every cell has every mineral, you will have more stamina and vitality. You'll be much less fatigued. And when your body has to heal, wound healing is so much better. And the reason it works is because it's eliminating toxins, it's building a stronger immune system, and the whole building block scenario is revitalizing, revolutionizing the wellness program of your life. Minerals are much less accessible in today's market because of the way farming is going, and I promise you, even if you eat organic, you're not getting anywhere near the mineral complexes that you need. We've taken care of business, and we put it in our product. Our coenzyme Q10 is the spark of the spark plug, you know, fire in the chamber. And when coenzyme Q10, every cell, all 70 trillion cells of the human body, utilize the spark of life. Coenzyme Q10 is part of the life-giving factor that only God can make. It's a peak performance for energy. We love coenzyme Q10 in our product. It's in a good high milligram dose to make an antioxidant defense. It's going to show pronounced enhancements in the brain. When you put coenzyme Q10 on a day-to-day basis, you will be able to concentrate and focus and be mentally alert. You're going to be much more robust. I'm talking about coenzyme Q10 is the electron transfer mover. It's the great nutrition for heart protection. And if you know somebody who has ringing ears, call them to isLife. We got the mineral complex and the coenzyme Q10 to make a big difference in tinnitus, ringing ears. Every diabetic needs more coenzyme Q10. Anybody who has ever suffered a cluster